Hi there and welcome. My name is Dr. Marlena Jabara, and I'm the proud founder of RadPodSquad. The RadPodSquad Fellowship offers an immersive learning experience tailored specifically to podiatric imaging. We've designed our curricula to elevate your confidence in this specialized field. RadPodSquad combines comprehensive curricula, cutting-edge techniques, and on-demand access to training that will provide you with the new knowledge and skills that you need to boost your confidence in imaging and truly make a difference in treating your patients. Check us out today, radpodsquad.com. Again, reminding us that when we're looking for the diabetic foot ulcer, one of the signs that we're going to be looking for is loss of the cortex. And although it is possible to evaluate it on the wide field of view, it can be very difficult to see the loss of cortex on these types of images. And I encourage you to magnify the image and look for the cortical bone. In this case, we can see there's cortical bone here, but we really can't see any cortical bone along the distal phalanx of the fifth. And when you look even closer, we can see that there's erosions along the tip of the fifth distal phalanx in a patient who has osteomyelitis. Of course, on MRI, that's even more apparent, and something called the eraser sign, and where we can see that there has been T2 marrow infiltration, T2 replacement, and of course, on T1, we have marrow replacement, and that denotes that this is osteomyelitis. And this is called the eraser sign or the ghost sign. Again, a reminder on this x-ray that you want to magnify your images because it can be very hard to see a hammer toe, which can be ulcerated at the dorsal aspect, usually poorly fitting shoes. The hammer toe becomes blisterous and opens up, and you get that direct spread of infection towards your hammer toe. And here we can see that in another view on this wider field of view blown up here on the left. And on the MRI, we can see that T1 marrow infiltration occurring at the distal aspect of that proximal phalanx involving the middle phalanx altogether. Here we have a transaxial image denoting that hammer toe and the T1 marrow infiltration. Also notice these changes along the metatarsal pad. That's actually a pressure point, and if we can inspect the skin to determine whether there's an ulcer. Showing more examples as shown here of the marrow edema and the marrow change that occurs at the proximal phalanx and the middle phalanx, and of course marrow edema here. But the diagnosis of osteomyelitis is made on the T1 marrow infiltration seen here. Are you ready to take your podiatric imaging skills to new heights? Check us out at radpodsquad.com. Explore our online learning community. And don't forget to like and subscribe to our YouTube channel for more enriching content.